What causes UTIs and how can they be avoided? Urinary tract infections are common and can be uncomfortable, but understanding what causes them can help you prevent future infections. Most UTIs are caused by bacteria, with Escherichia coli, or E. coli, responsible for over 90% of bladder infections. These bacteria normally live in the intestines but can enter the urinary tract through the urethra. Other bacteria like Klebsiella pneumoniae, Proteus mirabilis, Enterococcus faecalis, and Staphylococcus species can also cause UTIs, although less frequently. Sometimes fungi or viruses may cause infections, but these are quite rare. The infection starts when bacteria find their way into the urethra and then multiply in the bladder. Because women have a shorter urethra and it is closer to the anus, they are more prone to UTIs. Several factors can increase the risk of bacteria entering and infecting the urinary tract. Sexual activity can introduce bacteria into the urethra, especially if proper hygiene isn't maintained. Using certain types of birth control, like diaphragms or spermicides, can also raise the risk. Menopause can cause changes in the urinary tract that make infections more likely. Structural issues like urinary tract abnormalities, kidney stones, or an enlarged prostate can block or irritate the urinary system. A suppressed immune system, such as in diabetes, can make it harder for the body to fight off infections. Catheter use and recent urinary procedures can also introduce bacteria, increasing the chance of infection. Preventing UTIs involves simple but effective steps. Good hygiene is key. Washing your hands before and after using the bathroom or engaging in sexual activity helps prevent bacteria from entering the urinary tract. Drinking plenty of fluids keeps the urine diluted and helps flush bacteria out of the system. It is also helpful to urinate regularly and completely, avoiding holding urine for long periods, which allows bacteria to multiply in the bladder. After sexual activity, urinating can help wash away bacteria that may have been introduced during intimacy. Using gentle, unscented soaps and avoiding harsh feminine hygiene products or douches can keep the urinary environment healthy. If you are prone to UTIs and use certain birth control methods, discuss with your health care provider about alternatives that might reduce your risk. Managing underlying health conditions like diabetes is also important, as well-controlled health can lower susceptibility. For those who need urinary catheters, strict sterile techniques and proper care are essential to prevent infection. From a bladder health perspective, preventing UTIs is especially important because recurrent infections can cause ongoing inflammation of the bladder lining. Chronic inflammation may damage bladder tissue and has been linked to an increased risk of bladder cancer over time. By taking steps to reduce the chance of infections, you support overall bladder health and may lower the risk of complications. Remember, if you experience symptoms like burning during urination, frequent urges to urinate, cloudy or foul-smelling urine, or pelvic pain, it's important to see a healthcare professional. They can provide proper diagnosis and treatment options. Always consult your healthcare provider for personalized advice, especially if you have underlying health issues or recurrent infections. Taking care of your urinary health is a vital part of maintaining your overall well-being.